Hi guys, welcome back to sqadia.com. Have you ever experienced a radiating pain in your joints without any reason, especially in your elbow? So much that you were unable to move your elbow. So what could be the possible causes of this pain in your elbow? Let me discuss with you a similar case today. A 39-year-old African American male patient was admitted with 1-day history of acute left lower quadrant pain and was diagnosed with acute uncomplicated diverticulitis, confirmed by CT of the abdomen. His medical and surgical history was unremarkable, and he denied any medication use. He denied smoking or illicit drug use, but admitted occasional alcohol use on every other weekend. He didn't follow any particular diet. He had an average build with BMI of 29.6. He was started on intravenous antibiotics and pain medication, which led to significant clinical improvement within 2 days. But on the 3rd day of hospitalization, he developed acute, severe pain and swelling of the left elbow. Within the next 4 hours, the pain was worsened and he was unable to move the elbow joint, which was tender, erythematous, and swollen on examination. Never investigated in the past, we also noted a foreign mass which showed the dimensions of 4 to 6 centimeters on the elbow, and another one surrounding the proximal interphalangeal joint of the right middle finger. There was no overlaying edema or cellulitis. There were no other swellings or tophi noted especially on the toes or ears. When asked particularly, he denied similar episodes in the past. He also denied any episodes of swelling of the great toe in the past. Now, his synovial fluid was aspirated for analysis. Now, let's have a look at the synovial fluid analysis. The results basically showed the white cell count was on a higher range, which basically indicated an infection in this particular case. On the other hand, no organism was isolated from this aspirate. Then we noted crystals of monosodium urate which were found in the synovial aspirate. You can clearly observe the presence of these crystals in this report. So after that, he was started on colchicine and he responded well to the treatment. Colchicine was used at the dose of 0.6 milligrams every 2 hours. He received a total of 6 doses, but it was stopped because he developed severe nausea and vomiting. He admitted that his pain was reduced to 4 on 10 in intensity from 9 on 10 before treatment, but swelling was persistent. We then initiated indomethacin at 50 milligrams every 8 hours. And his pain and swelling were relieved to great extent in 48 hours. So let's dig into this condition, which is known as gout today, and clear our concepts regarding it. Today, I'll be focusing on the specific joint-related pathologies, which are known as arthropathies. And specifically, we'll be zooming into the crystal-related arthropathies that are defined as a syndrome of synovitis in response to crystal deposition or formation in the joint. 2 types of crystals are commonly implicated. First, we have the monosodium urate, which results in gout. And then we have the deposition of calcium pyrophosphate dihydrate, which results in a condition which is known as pseudogout, as it mimics the gout. The resulting synovitis may be limited to a single joint, which we'll be referring to as the monoarticular condition, or it can become more widespread and involve multiple joints. That is why it will be termed as polyarticular. Gout is the more common entity that we'll be focusing on for today. Gout is a very painful form of arthritis, which is caused by crystals that form in and around the joints. It's the most common type of inflammatory arthritis. It's more common in men, and you're more likely to get it as you get older. Gout occurs in people who have high levels of urate in their blood. But having urate in your blood does not mean you will develop gout. It's normal and healthy to have some urate in your bloodstream. Urate is created every day when our bodies break down the purines. Purines are chemicals that are naturally created in our body. But they're also present in certain foods, such as alcoholic beverages. Then some fish, seafood, and shellfish, including anchovies, sardines, herring, mussels, etc. Then some meats such as bacon, turkey, veal, and organ meats like liver. All these contain high levels of purines. People used to think that gout was caused by overeating and drinking too much alcohol. While this can make attacks of gout more likely, it's not the whole story. In any day, about 3/4 of the urate in our body comes from the breakdown of purines produced within our body, while only about 1/4 comes from the breakdown of purines in food and drink we consume. Having said that, let's have a look at the risk factors that can basically predispose a person towards the development of this condition known as gout.